I'm a fool for your love.
What's up, guys? Welcome back to Patho and Chill. I hope you're having a wonderful day. Today we're going to be talking about assessing the functional capacity of your patient prior to your dental treatment. So the importance of assessing your patient's functional capacity is to check their cardiovascular health. So basically this is measured in MET, also known as metabolic equivalent, and it basically gives you key insight into your patient's ability towards performing daily living activities that require minimal aerobic metabolism. And so this is basically going to be assessing their cardiovascular health, their pulmonary health, and their skeletal muscle health. Okay, so now let's jump a little more into the MET, so the metabolic equivalent. And so this is defined as the oxygen consumption of a 40-year-old man that weighs 70 kilograms at rest. That is equivalent to 1 MET. So there's usually a range of 1 through 10, with the first 3 involving more just literally basic activities. So can they wake up and make their bed? Can they eat? Can they go to the restroom? Drink water? A walk consisting of 2 to 3 miles per hour. Any of those things are considered 1 through 3 METs. Then you move on to around 4 to 7, which involves a little more strenuous things, still pretty basic things, such as walking up the stairs, being able to go for a light jog or a pretty fast walk, or as far as cleaning your house, doing the dishes, doing your chores that no one likes to do. Those type of things get you in that range of 4 to 7 METs. And then we jump on to like 8 to 10, which involves more strenuous sports. So in the lower ranges, such as like going and playing bowling, tennis, or the more strenuous ones, such as playing football, soccer, running cross country, track, long distance sports like that. And so overall, getting this information from your patient is going to be able to assess their ability to withstand the stress of the dental treatment. And so basically, when it comes to actually assessing their overall cardiovascular health, we're going to start off with 5 bullet points, right? So number 1 goes into actually assessing any clinical predictors. And so here we're going to jump into the major risk predictors. And so there are 4 different types that you must absolutely know. Number 1 being unstable coronary syndrome. So if they've had any recent myocardial infarction within the past 30 days, or unstable angina, all of those are going to indicate an unstable coronary syndrome. Number 2 being decompensated heart failure. So if they're having any actual symptoms such as fatigue, lightheadedness, shortness of breath, any of those type of things could be a potential indicator for a decompensated heart failure. Number 3, we have severe valvular disease. And so I did a video over this earlier on. So if you haven't seen that, make sure you go check it out. And so basically that goes on into any of like the mitral valve stenosis, aortic stenosis, regurgitation, any of those type of things could potentially be a major adverse cardiovascular event. And number 4 goes into any types of significant arrhythmias that can actually impede the well-being of a patient. So not all of them actually count, things like tachycardia or bradycardia could be of lower risk, but you have to assess. Things like 3rd-degree block or ventricular fibrillations are clear indicators of potential adverse cardiovascular reactions. And so those are the major problems. And then we can move on to more intermediate ones, which involve any types of ischemic disease, diabetes, renal insufficiency, or even a previous history of stroke. Those would be more intermediate things that you should be on the lookout for. And then finally, we jump onto minor things being increased age. So, the older the patient is, the more there is a potential risk, but obviously that risk is not very high. Uncontrolled hypertension. This one, while it's not necessarily considered a major adverse cardiovascular event, it can be a high increased risk of stroke. So that kind of falls under another different gray line. However, for cardiovascular health, it's technically not considered a high risk. Okay, so after you're done assessing their clinical predictors, then you're gonna jump on to their vitals. So you're gonna assess their blood pressure. So do they have potential white coat blood pressure, which is when the patient's blood pressure may spike a little bit, about 10 millimeters of mercury before their actual procedure, which can be normal. You need to be on the lookout for potential orthostatic hypotension. And so new guidelines have actually been set for hypertension, in which now anything ranging from 120 to 129 over less than 80 is actually considered elevated blood pressure. And meanwhile, anything between 130 to 139 over less than 80 is considered stage 1 hypertension, and anything above that could potentially be considered stage 2 hypertension. Then you're gonna wanna move on to their pulse, make sure that it is between the normal ranges of 60 to 100, and finally, a normal respiratory rate for an adult, which should be around 16 to 20 breaths per minute. And so the last 3 things that you're gonna wanna do is assess for an accurate medication profile. Then you can actually assess their functional capacity. So once again, going back to the METs, and finally, the stress for planned dental procedures. And so what basically you're going to want to do is minimize any potential stress, right? So avoid long appointments is very important. You want to make sure you let them know about orthostatic hypotension and make sure they are getting up slowly out of their chair. You're going to want to make sure that the patient is always in charge, meaning that if they need a break, you give them that break. So bottom line is that if your patient presents with any of the major clinical predictors that we talked about, including the unstable coronary syndrome, decompensated heart failure, severe valvular disease, or any significant arrhythmias, you're gonna wanna stop dental treatment right away. Additionally from that, you're gonna wanna stop if your patient presents with an MET of lower than 4, meaning that they struggle to do basic living activities, or also if their blood pressure is extremely elevated, meaning that it's over 180, over 110. All of those clearly signal that the patient may not be able to withstand the stress from the dental procedure, and you may not want to proceed from there. Anyways, that is all I have for you today, guys. If you enjoyed the video, please make sure you hit that like button down below, subscribe, and go check out my other videos. As always, I hope you're having a very chill day. I will see you next video, and peace out.